Welcome, everyone. Let's dive right into this explainer and explore how we're rigorously conquering staggering biological complexity. Today, we're unpacking computational modeling. This is a paradigm that's fundamentally transforming systems biology, changing exactly how researchers translate the physical world into predictive data. For those of you out there actively working to map intricate cellular pathways or massive physiological systems, you already know this methodology is rapidly becoming the absolute core of modern scientific inquiry.
It's literally the ultimate question, right? How do we simulate life without physical testing? For researchers wrestling with biological networks that are simply too interconnected, way too expensive, or just too delicate for endless physical trials, this is the holy grail. I mean, in vivo and in vitro experiments are always going to be foundational, but we increasingly need robust frameworks to rigorously test our hypotheses in silico before we ever step foot back in the laboratory. So, here's our roadmap for today. We're going to cover 1. The ubiquity of modeling, 2. Modeling multiscale biology, 3. Verifying and validating models, 4. Testing real-world assumptions, and 5. The future of simulation.
All right, part 1, the ubiquity of modeling. Let's start by establishing why this has become the backbone of modern science.
The truth is, computational simulation is everywhere. We're talking traffic flow analysis, managing incredibly complex energy grids, massive supply chain logistics, flight simulations, and, of course, healthcare. These models use sophisticated mathematical algorithms to translate what we observe in the real world into highly accurate predictions. It gives us this massive sandbox, a risk-free virtual environment where we can optimize designs, find bottlenecks, and test crazy edge case scenarios across every major industry, all before a single physical resource is actually spent.
Which brings us to part 2, modeling multiscale biology.
Now, when we try to apply that industrial predictive power to living organisms, the complexity absolutely skyrockets. Just look at this. We're dealing with massive networks of metabolic pathways and purine metabolism. We're talking thousands of interacting enzymes, thousands of reactants. There are biological pathways where the reaction rates depend entirely on the shifting concentrations of things that aren't even participating. It's wild. You simply cannot track this level of dynamic complexity using human intuition alone. Computational modeling isn't just a nice-to-have here, it is mandatory for truly understanding systems biology.
So, how do we manage all this chaos? Well, we use multi-scale modeling. It's kind of like a giant puzzle. We strategically combine entirely different mathematical methods to treat different segments of a system. We use subatomic quantum mechanics to look at fundamental molecular features like electron transfer. Then we step up to molecular mechanics to handle complex protein folding. And then we zoom way out to macroscopic continuum electrodynamics for large-scale tissue responses. By bridging all these temporal and spatial scales, we can accurately simulate how a drug binds to a single receptor and watch exactly how that microevent cascades through an entire organ system.
And the scale we can achieve with this is just mind-blowing. 30 million. Using multiscale modeling, researchers have successfully built a computational model of the mouse primary motor cortex that features over 10,000 neurons and 30 million individual synapses. This model folds in deep electrophysiological data, and it can actively predict neural responses for different behavioral states. It completely sets the stage for massive synthetic experiments that would be literally impossible to conduct in vivo.
But let's move to part 3, verifying and validating models, because we need to be realistic here.
Look, just because we can mathematically simulate millions of synapses doesn't mean our output is actually reliable. You absolutely have to distinguish verification from validation. Verification asks, did we build the model right? Meaning, is your math sound? Is your code free of software bugs? Validation, on the other hand, asks a much deeper scientific question. Did we build the right model? Does your simulation actually represent real-world physics and biology? Because honestly, you can have a flawlessly coded model that is completely 100% biologically invalid.
To prevent that, we rely on Naylor and Finger's classic 3-step validation framework. It's the gold standard for testing simulation accuracy. Step 1. You build a model with high face validity. Basically, does the overarching logic look sound to other subject matter experts? Step 2. You rigorously validate the foundational assumptions baked into your math. And step 3, you compare the model's theoretical inputs and outputs directly against the empirical data of the actual real-world system. Step 2 is particularly critical because your assumptions are almost always where things break down. They usually fall into 3 buckets. Structural assumptions dictate how the system physically operates. Data assumptions relate to the reliability and statistical distribution of your inputs. And simplification assumptions? Those are the intentional abstractions we make just to ensure that complex math is actually solvable, like simplifying the Navier-Stokes equations for blood flow. When biological simulations fail, it's almost always because of a bad structural premise, weird data distributions, or a simplification that strayed just a little too far from reality.
Which brings us right into part 4, testing real-world assumptions.
Let's zoom in a bit more on why we have to constantly anchor our theories to hard data. Consider a super basic two-compartment thermodynamic model that's exchanging energy. Even in a simplified system like this, your assumptions about the exact rate of energy transfer have to be parameterized using real-world experimental data. You can't just guess. If your underlying thermodynamic constants are wrong at this foundational level, a massive multi-scale simulation built on top of them will just compound those errors exponentially, and the whole thing falls apart.
Now you might be thinking, what if I just don't have the empirical data yet? Well, you don't abandon the model. Instead, you let the model's blind spots tell you what to do next. Data collection has to go alongside theory and model development. It creates this incredible positive feedback loop. Building the model shows you exactly what mechanistic data you're missing. That tells you what specific lab assays to run, which gives you better data, which in turn makes the next iteration of your theoretical model way more accurate.
We do have to be super careful about one major statistical trap, though: overfitting. Overfitting happens when you parameterize a model so specifically to match your limited training data that it completely fails when it encounters new real-world biological phenomena. If we rely too heavily on small experimental datasets without doing broad external validation, we're essentially just tricking ourselves. We end up interpreting random mathematical noise as actual biological breakthroughs, which is a massive pitfall.
All right, finally, part 5, the future of simulation. Let's pull back and look at the big picture.
The absolute cutting-edge frontier of all this is the digital twin. A digital twin isn't just a static snapshot. It's a dynamic framework that pairs a highly detailed computational model directly with its physical counterpart in the real world. They communicate continuously. It's a virtual mirror of a real-world system that constantly learns, assimilates, and updates itself based on incoming physical sensor data, which allows for incredibly accurate real-time predictions. It's a total game changer.
In medicine, the implications are just profound. Imagine a cancer patient having a digital twin. Oncologists can integrate ongoing lab tests and medical images right into the model. As the actual patient's tumor shrinks or grows, that real-world data continuously updates the digital twin. This means doctors can run a massive variety of personalized, multi-scale therapeutic regimens entirely in silico. They can risk-free test clinical outcomes before they ever administer a novel compound to the human patient.
And looking just over the horizon, we're currently figuring out how to fuse the raw pattern recognition power of machine learning and the mind-bending potential of quantum computing directly into these models. We are rapidly moving toward a capability where we can dynamically switch between spatial and temporal scales in real time. We're talking about accurately simulating biological interactions that involve millions of atoms, completely bypassing the traditional computational bottlenecks that hold us back today.
So I'll leave you with this final provocative thought. As these highly rigorous, empirically validated simulation tools effectively become the new biological laboratory of the 21st century, what complex system will you decode next? The tools are ready, the mathematical frameworks are scaling, and the biological possibilities are endless. Thank you for exploring this overview with me. Keep questioning, keep modeling, and I'll see you in the next explainer.